Hi, I'm Dr. Greg Apsey, practicing dentistry in Warren, Michigan. This is my friend, Dr. Robert Antolak.
Hi. Yes, and we're located in Shelby Township, Michigan. Our phone number is 586-247-3500. Our website is thegentledentist.com. Dr. Apsey and I got together today, and we just wanted to, we are good friends, and we've known each other for almost 30 years, been in practice for 25 years each of us, and we felt it was very important to discuss this issue that you may have heard about, which is the sterilization of the Tulsa, Oklahoma oral surgeon, and who could have contaminated up to 7,000 of his patients.
Right. The concern is, amongst the patients, is it safe to go and have dental care done? In this office, there were supposed issues of cross-contamination, a spread of AIDS from the office to the patients, or a possible spread of AIDS, and talk of rusty equipment, lack of following protocol, monitoring the sterilization equipment. So my understanding about the passage of HIV is that it's passed via blood-to-blood contact. It is not an easy disease to pass, and if it indeed was passed by the dental office, there is clearly lack of sterilization of the equipment.
Yeah, and then I want to say too is that the greater majority of dentists are not. This is such a rare occurrence that is happening. So no matter where you go for your dental care, you have to know that you're most likely. In fact, dentistry is probably even more controlled than in a medical community. So we follow proper protocol. For example, all of our sharps were used one time. We take a needle, it's used one time and disposed of, and then that whole thing is managed by a waste management company for contaminated instruments.
Anything plastic that goes into your mouth, suction tips, anything plastic covering any barriers, covering the chair, or covering the handles of the lights, are one-time use only. The treatment room is scrubbed from top to bottom between patients every single time. The autoclave, the instrument that we use to sterilize the instruments, it must be monitored. We have a special strip of a spore strip, we call it, that's placed inside of the autoclave. Every 2 weeks we run a spore strip in the middle of a densely packed autoclave, and we send it to a lab and we test, and we are continuously monitoring to make sure that that autoclave is working properly so that there is no possibility of cross-contamination.
That's right. And what's really important also is that our staff members are protected. You know, we want to follow what are called OSHA guidelines and CDC, which is Centers for Disease Control. They have certain standards to go by in practicing care. You know, one thing you can do, just as an observer to whatever dental practice you're going, if you just look around, look around the environment, see if it's dirty. If there's cobwebs and stuff like that around, you might question that. I know at our office many times I ask, so why are you here? I didn't like it, didn't look clean, it looked dirty. You have the right to ask whatever your provider is, what do you do to keep this area safe so I can have myself and my family and my friends go here and I can refer them with confidence.
Right. In fact, my patients, ever since hearing that, and I think in some ways, of course it's horrible that this happened to so many people in Tulsa, Oklahoma, but this brings up the discussion, and I think the discussion should be regularly had between patients and doctors. There should be no fear in talking with your doctor directly about what's happening in the office and how safe you really are. And I've had many of my patients come and they feel very comfortable talking with me, and I'm very comfortable showing them all the things we do to keep them protected, keep them safe. I really believe in a healthy, clean environment, and my patients deserve that. They're paying for that. We're fellow human beings. We need to treat each other the proper way. So,
that reminds me of back in the late 80s, early 90s. Akers was his name, and he was an oral surgeon, I think, also. And he actually contaminated blood and injected into his patients. And that's when the first started of us using gloves. Gloves used one time thrown away right away, using masks, using eyeglasses to protect ourselves. And you know, that was the first calling of it, and that was way back quite a few years ago, but now this other incident took place. But between those two times, the reality is this has not happened very often. It's good to talk about it, it's good to ask questions. And if someone is defensive about the questions, you have to, in my opinion, you have to ask what their intention is behind it and how they really are following protocol.
Right, and ask the question, how are the handpieces handled, the drills that are used in your mouth? Those drills are meant to be sterilized every time after every use. They should be lubricated and sterilized every single time. And if they're not, they're being wiped down only. And there is some risk of cross-contamination if that's the way they're being cleaned.
Yeah, so if you have any questions, you know, you can contact Dr. Apsey's office, 586-573-7700.
Or Dr. Robert Antolak's office at 586-247-3500.
You got it. So thank you. For questions, please give us a call.
Thanks for listening.